As your body's leaning to that right side, it's putting a lot of stress on that side here. So let's take a look. Let's see what we're going to be adjusting on you today. I know you said the upper back and the shoulder. Where do you feel that? Is it more right in this area, or can you point to where you're feeling that?
Right over here.
So right where that was. Okay. Are you getting the pain that's just going right across the shoulder, or is it just pinpointed right here?
Across the shoulder.
Across the shoulder. So it does kind of radiate over to this way.
Uh-huh.
Okay. And then the lower back, obviously we talked a lot about that. It's a chronic issue, but where do you feel the lower back pain?
Lower right over here.
So it's like right across. So everything's on your right side, right?
Yes.
Okay. Yeah. That makes sense. Okay. So especially when you're seeing that your spine on the top here, how we talked about your x-rays, how it's leaning out to that right side. Remember how we talked about if like you had like two scales, one side would weigh more. As your body's leaning to that right side, it's putting a lot of stress on that side here. So let's take a look. Let's see what we're going to be adjusting on you today.
Okay.
But we're going to start from the bottom, work our way up, then work our way back down to the bottom. All right, let's take a look here. All right, so these are probably going to be our biggest things that's going to really help out with a lot of that stress that you're dealing with. But like we talked about, we want to look at the whole spine, not just where you're feeling the symptoms at, because, right there too. Yeah, right there. And then a little bit lower. Yeah, right there. Okay, so let's talk about what we're going to start with, and then we'll get you adjusted here. So the first things first, so right over here, 1, 2, 3, 4, 5. So here's your C6, C7, 6, 7. Which is more tender, if any?
7.
7 a little bit more. So this one right here. I want to tilt you over to the right, tilt you over to the left. And then here. Okay, so yeah, so C7's pretty restricted there. 1, 2, 3. Here's T4, 3, T4, 5. Any source on those ones?
Maybe 5.
This one right there? Yeah. Alright. And let me take a look here. We might want to work on that one. So 5, 4, 3, 2, 1, 12, 11, 10, 11, 12. Any soreness on those ones?
10.
10 a little bit more? Okay. Was this as sore as the ones up here? Or were these ones worse than this one?
Probably the top.
The top one more? Okay. Okay. Yeah, we still might. Yeah, right there. So right in here, you'll start to feel like, as I'm rolling through your skin here, you'll feel like a little bit of a dip right into here. That's where we're seeing a lot of the edema and the swelling. So when you have a joint that's misaligned, you'll get swelling that accompanies that area. And right here, we are seeing some of that stress. So we are going to probably work on that T10 as well. And then we got to do that lower back. I'm going to take a look real quick. This is your L5, S1, S2. 1. Yeah, 1 is not moving much at all right there. So that's your sacrum or your tailbone.
I can feel it.
Yeah, we're going to start off at S1. So we got a lot to do today, okay? So we're going to start off with your neck, and then we're going to go with your lower back, and then we'll do your mid back right after, okay?
Okay.
All right, so let's get you going, man. So right here, all you got to do, bring your feet out in front of you just a little bit more. There you go, nice and relaxed here. And from here, I'm just going to tilt you over right there. And you just got to relax that shoulder. And as you relax, I'm going to get a bit of a push right there. Oh, that's a little bit more here. Drop the shoulder. There's the rest. Okay, good. Come on up. All right, let's get you nice and relaxed. Let's get that sacrum or your tailbone here. There's your 5, your 1 right there. Gonna wait just a bit. I will drop you. Let that shoulder drop. There you go. Good. Good, a little bit more. Okay,
There you go.
come on out. This might be a little sore.
Mm-hmm.
If we can get some movement on there, it's going to help a lot though. So bring your chin up just a little bit. All the way. Good. One more time. All the way out. Good. Nice. Good adjustment.
Mm-hmm.
One more here. 6, 7. 1, 2, 3, 4, and then 5 right there. Okay. All the way out. There we go. Nice. Good
There you go.
adjustment. There's a lot of work that needs to be done on both the bottom and the top, even the mid back. And so a lot of times when these issues are pretty chronic, it can take some time and it's going to take some work. So there's some things that you're going to need to do at home to really help with this process here. So we're going to send you some videos. We're going to send you some links so that you can watch some of the videos on ergonomics and some postural things, some things that you need to start doing, as well as things that you need to stop doing as well. Yeah, it's looking much better here. Good.
Okay. Yeah, it feels a lot looser.
Good.
Doesn't make a sound when I do this.
Nice. The crickling and cracking. Good. Yeah. And sometimes you'll have the opposite effect where we start getting some joint mobility in the spine. And because your body's been compensating over the years, once we unlock that area where it's been stuck for so long, the body will start to undo a lot of that stress. And so a lot of times we're going to start to see your body is trying to go back to where it should be. And it can really you'll start to experience and feel different changes within your body. Yeah, looking good, man. Things are looking really good. So you can expect that. You know, one, you can start to feel a lot better. There's pain in the shoulder and the knot that you're feeling, that will start to dissolve. But sometimes we'll see that the irritation that you have here, it might shift, it might change, it might move, just because as we move the structure, the body's trying to readapt as well. But over a period of time, you're going to start to feel a lot better with that, okay?
Got it.
All right, man. Well, you're doing really good.
Alrighty.
We'll see you then on your next appointment. The biggest thing I want you to do for me is getting some movement in, okay? Just like we talked about when we unlocked that spine, things starting to move better. Walking is the best form of exercise right now. So 15, 20 minutes, 30 minutes if you're able to. But as you start to walk and allow your body to move, it's letting that process occur of the undoing and unwinding of the stuff that's been going on for so long. Okay? All right, man.
Alrighty.
Well, good to see you, man. I'm expecting some good things for you. I'm excited. So we'll see how things do one day at a time. But we'll go from there. So we did.
I could actually turn this way now.
Can you? Yeah. Well, we're just getting started.
There
man.
you go.
We're just getting started. But you'll start to be able to do a lot more things here. All right, man. You're all set.
Thank you.
We'll see you next time.
Will do.